Hi, I'm Jackie Russell. I've been a surgical orthopedic nurse for longer than I'd like to admit. But I've coached a lot of patients through total joint replacement surgery. And the ones that do the best, they're prepared. They're educated, they are optimistic, and they're confident that they're going to do well. So that's what we're going to talk about today. We're going to talk about your path to recovery. Your surgeon recommended that you have joint replacement surgery so that you can live a joyful life. What do you love to do that you can't do now because of pain? Is it hiking? Is it playing with your grandchildren? Is it climbing to the top of C deck at a stadium to watch a football game? That's what we want to get you back to. And so today, what I'm going to go over are things that you need to know before surgery, what's going to happen when you get to surgery, and what are the important things after surgery. Your family and friends are a huge part of this. Your team of care partners need to be as educated as you are. So while you will be doing most of your own care, you're still going to need a little bit of help at home. So pay attention, have your care partners pay attention, and you're going to do great with this surgery. You've already started the first step to a successful recovery, and that is watching this total joint educational class. The second step is to schedule a pre-op physical therapy visit. The pre-op physical therapy visit is an important part of your successful recovery. It's a one-on-one evaluation with an Orthopedic 1 physical therapist, and you can attend this education at any of our physical therapy locations. You will receive a packet of information, and this information is also on our website. But in that packet, there's a list of all the Orthopedic 1 physical therapy locations, and you can choose from any one of those to do this pre-op visit. When you go for this visit, you're going to learn so much about what's going to happen at home. Please bring your care partner to this physical therapy evaluation. You're going to learn things about the best way to get in and out of your car, how to use your walker at home, going up and down steps, what's the best way to use my cane, how can I get in and out of a chair easily. All of these things are very important to your safety and your recovery at home. They're going to assist you with individual goals, talk with you about what your problems are or what your worries are, and review all of our exercises both before surgery and after surgery. This is an important visit, don't miss it. Your preoperative exercises are exercises that you will be performing before you go into the hospital. You should make sure you perform these exercises on both legs. You need strong muscles to support your new total joint, and so make sure when you're doing your exercises at home, you hit both legs. We're going to talk more in detail about those preoperative exercises later, but if you have any questions about what exercises you should be doing, call your surgeon's office. I'd like to show you the adaptive equipment package. These are available for purchase separately or together in a package. Let me just show you what comes in this package to see if you may want to use it. There's lots of things you can use these tools for. This is a dressing stick. It's nice for taking socks off or pulling pants up. You can also use it to help put a coat on if you've got a stiff shoulder. Lots of uses for the dressing stick. There is a long-handled shoe horn, self-explanatory. It helps you avoid bending over when you're putting your shoes on. We've got a long-handled sponge, helping in the shower to reach places that you can't reach without bending over. We've got something called a sock aid. This helps you put your socks on without bending over and breaking some precautions that you may have after your joint replacement surgery. This sock aid fits any sock. I'm using a sock from the hospital. You put it on the end, pull it on as far as you can. This is my leg and my foot. I'm going to push that all the way through, and then I'm going to, with these two handles, pull the sock aid out, and the sock is on my leg. Last thing I have here is a reacher and a grabber. It's great for picking anything up off the floor, helping you get things out of a low cabinet that you may not be able to bend down and get. So that's a grabber. Only thing I don't have on my table that's in the adaptive equipment package are the elastic shoelaces. They fit into any tie shoes, and you can make a tie shoe into a slip-on shoe and simply snug up the elastic. So there's the adaptive equipment kit. If you'd like to search on Amazon or on Walmart, you can buy these things separately, or if you'd like to buy them in a package, most insurance companies do not cover the cost of this kit. You will need a walker and a cane. The walker is one that has wheels in the front, and the cane is a single-pronged cane, not a tri-pronged or a quadruped cane. Those tend to increase your risk of falling. The front-wheeled walker can be borrowed. You can buy one at Walmart or CVS or Walgreens, or you can get that walker when you come to surgery at the hospital or at the outpatient surgery center. When you go to your pre-op physical therapy visit, they'll help you with adjusting it and teach you how to use it, so you'll know if you borrow one, go ahead and bring it. Or if you buy one, go ahead and bring it to that visit. If you're just going to get one when you come to the hospital or the surgery center, they'll help you with a walker fitting and a cane fitting at the physical therapy assessment. You may want to consider getting an elevated toilet seat. Most toilets are very low if your house is a little bit older, and it's just very hard to get up and down off that seat. If you're going to buy a toilet seat extender, make sure you look at the size and shape of your toilet bowl so that it fits. You might want to consider a bedside commode. If you don't have a bathroom on the level that you're going to be staying on, a bedside commode is a nice idea. The other thing you can do with a bedside commode is use it as a shower chair. So that's just another option. Hospital beds, we just don't really recommend them. I don't think you're going to need one. Insurance doesn't cover it, but check with your surgeon about any particular equipment that you're questioning. We want you to go home after surgery. Do you have someone to help you at home? That's really important. If you're unable to get help at home after your surgery, call your surgeon's office for ideas. You need someone with you for about 3 to 7 days after surgery round the clock. You are going to be up and around taking care of yourself, but you're going to need someone to help you initially with maybe getting up and down the steps, getting your ice bag, preparing meals, doing laundry. You're just not going to be 100% when you get home. If you do live alone and you have absolutely no one to help you, just give us a call and we have lots of ideas to figure that out for you. You're going to need a arrange for transportation both to and from either the surgery center or the hospital. There's no place like home. Orthopedic One surgeons plan for you to go right home after your surgery. You're going to control your own environment at home. It's a nicer place to be. You may have to go up and down steps once or twice a day, and that's okay. We're going to teach you how to do steps at your pre-op therapy visit and then again in the outpatient surgery center or before you're discharged from the hospital. You can usually go up once at night and then come down once during the day, and that will eliminate the up and down steps with your walker. You're going to rely on your caregiver a lot for meals, ice bags, timing of your medications. Rest is very important. If you're not getting enough sleep at night, you may need some help with positioning your legs. Sleep is important, so we'll focus on that and call your surgeon's office if you have any questions or problems sleeping after surgery. If you're at home, we're reducing your risk of infection. That is one of the most important things I'm going to say this entire hour. There are less germs at home than in any other facility. So we really want you to go home. You can get up and down in your bed at any time. You don't have to put your call light on. We want you to get up and down. That's part of your therapy. So once again, there's no place like home. Now, if by chance you have talked with your surgeon and said, I really think I should go to a facility, a skilled facility, it's important to note, currently, most insurance carriers are not covering that. You have to have a medical necessity. You have to meet medical criteria to be discharged to a skilled nursing facility or a rehab and have your insurance pay for it. That determination is not made until you're in the hospital. So you need to have plan A and plan B. Plan A, I may have to go home. I may need to find someone to help me. Plan B, I think I'm going to meet the criteria to go to a skilled facility. If you do, it's a short stay, maybe 5 to 7 days. And then when you're discharged from that facility, you'll be able to go right to outpatient therapy. If you do go to a facility, you need to arrange for transportation to the facility and then again home. We do have a list of preferred skilled facilities that Orthopedic One lists based on Medicare 5-star quality rating system. You're welcome to look at that list if you want and investigate those before you go into the hospital. But remember, talk with your surgeon about this before you plan it. At Orthopedic One, our physicians and our staff respect your right to choose where you go after surgery. So let us know. Keep us involved in your thought process so we know how to plan. When you go home, our #1 goal for you is safety. We don't want you to fall. I want you to take ownership of this. I want you to go home today and look critically at your house. Take up your throw rugs. Look at the path you walk every day. When you walk from the kitchen into the family room, is there a coffee table that you're always bumping into or going around? Move the coffee table. There's no law that the furniture has to stay where it is when you come home with a walker. Declutter your house. Get all of the things off the stairs that you stack up there and try to take up in one load. Make sure that you have enough space around your bed to get the walker in and out, because you will be using your walker to help you get in and out of bed. Make sure you have a great chair to sit on. What's a great chair for you? One with arms, one that's got a firm cushion and a firm back, and one that's high enough for you. You may want to adjust one of your chairs by putting a thick or firm cushion on it, or if your couch is too low, double up your cushion so it's easier to sit on. You never want to use a chair with wheels on the bottom of it. No recliners. I know, you want to sit in your lazy boy. Whoever made that word up, we don't want you in your lazy boy. It's not a good fit for you after surgery. It doesn't allow you to get great circulation, and circulation heals your wound. So look at your recliner and say, I'm not going to be in that for 4 to 6 weeks. The most important part about a recliner is that you can't effectively elevate your legs higher than your heart. And that's an important step in your home recovery that's going to help you a lot. So say goodbye to your recliner for a short period of time. You'll be back to it. Let's talk about ice. You're going to need to ice your wound when you go home. There's lots of options for ice. The easiest one is to just get a bag of frozen vegetable. My favorite's peas. It's moldable. Get the huge bag and keep a couple bags in the freezer so you can rotate them out. Make sure you put a layer of cloth in between the ice and your leg or your skin so you don't get freezer burn on your skin. Now, if you'd like to make your own ice bags up, here's the recipe. Get the freezer bag, the 2-gallon freezer bags, and add 1 part rubbing alcohol and 2 parts water. Mix it up, put it in a second freezer bag, and make 4 or 5 of those up. Those turn out to be a nice slushy, icy surface that can be molded around your leg. I really like homemade freezer bags. But there's other options out there for ice, and there's some cooling devices that I'm going to go over. One is a Dura cold wrap. The other is a cold therapy pump with a pad. The other is a Game Ready. Please check with your surgeon if you are thinking about getting a cooling device. They may have recommendations for you. Any of these options for ice is going to work. Icing 4 to 6 times a day is absolutely mandatory when you get home. Pets. Do you have pets? Whether you have a Mastiff or a teacup poodle, they're going to want to jump on you the minute you walk in the door. They love you and they missed you while you were gone. But listen, make sure when you walk in that door the first time, your pet is somewhere else, because they're a fall risk. Whether you step on them or over them, you could trip. We do not want you to trip at home. So make sure your pets are sort of cordoned off when you get home. Get to know them after you're settled, and then try to avoid having your cats and dogs sit on your lap or near your incision until your wound is completely healed. We worry about infection, and we just don't want their faces or mouths near your incision. If you're gonna pet your pet, make sure you wash your hands. We just don't want anything to contaminate your wound. So keep your dogs away from you when you're walking around the house. Hire someone to do the dog walking while you're recovering. And soon you'll be walking that dog before you know it. Your surgeon's going to take a very detailed medical history from you at probably your first or your visit at the office when you're preparing for surgery. Things they're going to ask and things you're going to want to tell them include, do you have heart disease? Are you diabetic? Have you ever had a blood clot? Do you have any open wounds or dental infections? We're very particular about do you have any infections because we don't want your new joint to become infected. Do you have recurring infections, urinary tract infections, skin issues? Please be honest with your surgeon so that we can make sure your pre-admission testing or your pre-op screening is appropriate. If you have any sensitivities to inexpensive jewelry, earrings, watches, the rims on your glasses, if they break your skin out, just let your surgeon know. If you take any over-the-counter medicines, supplements, vitamins, CBD preparations, please make sure you tell your surgeon. Your preoperative testing, PAT as we call it, has to be done within 30 days of your surgery. That includes a history and physical, an EKG of your heart, lab work. If you're diabetic, we'll do an A1C to see how your sugar's running. It may also include a urinalysis, a chest x-ray. You may have to visit one of your specialists, cardiologist, a nephrologist, or any special physicians that you may see before surgery just to make sure you're a healthy surgical candidate. Check with your family doctor or the pre-admission testing doctor about what medications you need to stop, when to stop them, and what to take the night before surgery. That's a really important point. Any questions about that, call your surgeon's office. Now let's talk about what to pack in your big suitcase for surgery. You don't need a big suitcase. You just need a couple things that are very important. You need clean, loose clothes. Wear clean, loose clothes to the surgery center or to the hospital, and then pack another set of them. Just remember, we're going to be looking at your wound, whether it's your knee or your hip, so you may want to include a pair of loose gym shorts or a skirt, or if you're going to wear sweatpants, make sure they're very loose. You just need to be comfortable and covered. Remember, we want you to be dressed and ready to start your physical therapy after surgery. Make sure you bring undergarments and socks, and most importantly, some good supportive shoes because you're going to be walking with physical therapy. You can use those elastic shoestrings if you want to make your shoes into something you don't need to tie, or bring shoes with Velcro closures. Make sure you bring only your basic toiletries to the hospital or surgery center. You just won't need your entire medicine cabinet at the hospital. Your insurance card and your picture ID are important. Make sure you pack those. You do need a copy of your advance directives and your total joint education book, your reference guide. If you have sleep apnea and you use a CPAP or a BiPAP, bring that too. You should not bring your medications with you to the hospital. If you are having surgery in a surgery center, the outpatient surgery staff will call you a day or so prior to your surgery and go over all of these details because they may want you to bring some of the medications that they don't keep in their formulary. If you do use a prescription inhaler or prescription eye drops, go ahead and bring those with you. Bring a detailed list of your medications. It's really important that the nurses and the doctors know exactly what you're taking, and if you've had any new medications added, make sure you bring a list of them. Let's talk about opioids. Opioid-induced constipation. What's an opioid? It's a narcotic. It's a pain pill. You're going to have them. You're going to get some in the hospital, and you're going to use them after surgery. They cause constipation. It's probably our biggest phone call at the office is constipation. So let's talk about it a little bit. you're going to start preventing constipation before it happens. We'd like you to start on a stool softener. Take it as directed on the bottle. Some over-the-counter stool softeners are Colace or Senecot. Increase your fluids. Drink plenty of water, 7 or 8 glasses a day. Increase your fresh fruit and fiber. Fiber cereals are awesome to help prevent constipation. Now, as a side note, if you do have chronic diarrhea or problems with irritable bowel, consult your family physician, PCP, for how to manage postoperative constipation. Now, when you get home, this is important. If you don't have a bowel movement in 2 days, make sure you buy some milk of magnesia, have it on hand, take it as directed on the bottle. If you go 3 days or any longer than that, have something called magnesium citrate on hand. It looks like 7-Up in a bottle, but it will help relieve constipation. Now, if you go longer than 3 days, you need to call someone. This is important. So family doctor will be very helpful with this. If you want to call your surgeon's office, you can, but we're going to direct you to call your family doctor's office. Let's talk about the day before surgery and reducing your risk of infection. You're going to be taking 2 showers before surgery, one the evening before and one the morning of. Make sure you use the special soap that your surgeon provided or an antibacterial soap. Make sure you wash from top to bottom with a clean washcloth, from shoulders down to your toes. If you have a special soap, please avoid your eyes, your ears, and your private area, as it may be irritating. After you're done with your shower, put on clean clothing. Make sure you use a clean towel after your shower. And change your sheets so that the evening before you're sleeping in clean sheets, and it'll be nice to come home to clean sheets after your surgery. Please don't use any lotions, creams, or powders on your skin after showering. Now, deodorant is fine, but don't shave your legs. We want to avoid any opportunity for a nick or a cut or the risk of an infection. Don't bring any jewelry with you to the hospital. You can eat dinner the night before, but at midnight you need to stop eating and drinking. Now, there may be some specific instructions that you receive the night before from your surgeon's office that tell you it's okay to drink some clear liquids, and they'll tell you what time to stop. But the standard rule is nothing to eat or drink after midnight. That includes gum, water, mints, nothing. Any questions about that, call your surgeon's office. You're going to get a call from the surgeon's office and possibly even the outpatient surgery center the day before surgery with your arrival time, parking instructions, and any other last-minute details that they need to tell you about. This is the perfect time to tell your surgeon whether you've had any changes in your medical history, whether you have any new infections, whether you've run into the coffee table and cut your leg. Those are the important things for a surgeon to know. We don't want you walking into the operating room with any infection concerns at all. Open wounds, sores, a cough, a cold, the flu, let us know that. So on that day before surgery, remember, you're going to get a phone call probably somewhere after 2 o'clock in the afternoon. That's an important call. You don't want to miss it. If your surgery is on Monday, you're going to get that call on Friday. And I'm going to say this one more time. This is the time to let them know if you have any new open wounds, sores, or an illness. All right, what's going to happen when you get there? You're going to arrive at the hospital or at the outpatient surgery center, and you're going to go right to a preoperative room. Your family will go to the surgery waiting area. And once you get to your preoperative room, you're going to get put into a hospital gown. The nurses are going to start an IV on you. You may have to sign a couple additional consents, and you'll see your surgeon. He's going to mark the operative site. You're also going to see your anesthesiologist. This is a great time to ask any last-minute questions that you have about your surgery or about your anesthesia. Remember, you are your own best advocate. Let's talk about the anesthesia. This is a decision that's made between you, your surgeon, and the anesthesiologist or the nurse anesthetist. They're going to determine the type of anesthesia that's best for you and your surgical procedure. If you have questions about it, ask them then. And if you have any specific concerns, talk to your surgeon before you arrive at the hospital or the outpatient surgery center. Because if you need to check with the anesthesiologist before you even get there, we can make those arrangements for you. If you've had any problems with anesthesia in the past, let them know. Specific nausea, difficulty waking up. Those are all things that the anesthesiologist needs to know, and will be able to help you with particular medications that they give during the operation. So, you're rolling into the operating room, your family's in the waiting room waiting for you, and family members, this is probably going to take longer than you think. They need to get prepared in the operating room, and then the actual surgical procedure may take anywhere from 45 minutes to 2 hours. So you're going to be in the pre-op holding area for 1 to 2 hours, and then your surgery, and then you'll go into recovery. And that recovery room stay or the PACU stay could last anywhere from 1 to 2 hours as well. It may be 5 hours go by before you hear anything about your family member in surgery. Don't be alarmed about this. It takes a while. Now, you may have a tracker board that shows you where your loved one is during their surgical stay at the hospital or at the surgery center, but you will be getting updates from the staff, so stick around that surgery waiting area so you can get those updates. Most of you, if you're in the hospital, can expect a 1 to 3 day stay depending on how you're doing. That's very unpredictable and just a guideline. If your surgery takes place in one of our ambulatory surgery centers, you will be discharged to home within 23 hours of your surgery. If your surgery takes place in a hospital setting, you may go home the same day. Timing of your discharge will be based on meeting your therapy goals and how well you are doing medically. When you're discharged to home, you need to make arrangements for your ride to be there when the nurses tell you you're ready to go home. It'll probably be around noon the day after your surgery. You get discharged to home when you meet your functional goals. It has to do with how you're getting out of bed and how you're walking. And once you get home, your rehab begins. So what happens when you go home? Well, let's back up a little bit. Your homegoing instructions from the hospital staff or the outpatient surgery staff are very important. Make sure your loved one or your care partner is there when you get those last-minute instructions in the hospital, your discharge instructions, as well as have them attend the last physical therapy session that you're going to have. The helpers at home need to know the best ways to get you moving. This is a great time to ask questions when you're going through your discharge instructions. Medications can be very confusing. This is the time that you are going to be using what we call a medication tracker. There is a form that you can put all of your medications on and what time you need to take them. And the nurses at the hospital will help you with that because they'll know when you got your last medication at the hospital, so you know the time that you need to take the next one when you get home. If by some chance you don't have the Orthopedic One medication tracker, just ask your surgeon's office for one before surgery. You may also print a copy from the Orthopedic One website. You are going to be prescribed a blood thinner to reduce your risk of blood clots. You're going to be prescribed pain medication, as well as instructed to perhaps take over-the-counter pain medications or anti-inflammatories to supplement. Each surgeon is different with their protocol, so if you have specific questions about your meds, call your surgeon's office. You're going to get additional instructions about what to do for your wound. Can you shower? Do you need to change your dressing? Or can you leave that dressing on for a week and just shower? Ask those questions of the nurse before you leave the surgery center or the hospital. You're going to learn what exercises to do, so pay attention to that because your exercises that you perform on your own are very important. Make arrangements for your ride, again, to be there about noon the day you're going home. And once more, ask questions if you have them. This is a lot of information, you guys. So just pay attention to what the discharge instructions are and ask questions there, or when you get home, give our office a call. If you are interested in having non-narcotic pain medication options, make sure to ask prior to your discharge to home. This is a big question most people ask on a phone after they've been home for 2 or 3 days. How much activity is enough when I get home? Should I be resting? Should I be walking? Should I be sitting? So those are all great questions. Here's the rule of thumb. Don't sit for more than 45 minutes to an hour. The more you sit with your legs hanging down, the more swelling you're going to get. And we don't really like you to have to worry about too much swelling. So get up and walk around with your walker, or if you get to your cane quickly, about 5 to 10 minutes every hour when you're at home. Short progressive walks will help you decrease your stiffness, increase your strength, and build up your endurance. We would really like to reduce your risk of blood clots. And swelling contributes to the formation of blood clots, as does inactivity. We're going to encourage you to elevate your legs higher than your heart 4 to 6 times a day, or approximately every 4 hours, for about 20 to 30 minutes each time. You can't do that in a recliner. You need to lay flat with your legs propped up, and that's a nice time to ice. Let pain and swelling be your guide for activity. I can't tell you the number of patients I've talked to on the phone that call me on the 3rd day post-op and say, wow, I felt so great when I got home that I really walked around a lot, and I think I'm paying for that. Overachievers don't win here. Follow your instructions. Don't overdo with your exercises or your walking. It's not no pain, no gain in this scenario. Every 3 to 4 hours, ice and elevate. I can't tell you that enough because so many patients just don't seem to hear that and come in with excessive swelling and then say, gosh, I didn't really know I needed to ice and elevate. 20 to 30 minutes of ice and elevation 4 times a day, especially the first couple weeks when you get home, is so important. Don't leave the ice on longer than 20 to 30 minutes. Always put a barrier between your skin and the ice bag. A clean t-shirt or a thin, clean towel make great barriers to protect your skin. Make sure when you elevate your legs that your toes are above your nose. This gets your leg higher than your heart and really helps alleviate some swelling. You have to be flat. If you're going to use a pillow under your head, make it a very thin or small pillow. You can use your large bags of ice now. You can use your cooling devices now, but don't use your cooling device at night. And you really don't need to prop your legs up, toes above nose, all night long. It just doesn't facilitate great sleep. Don't sit with your legs hanging down longer than a meal. So here's what your day is going to look like. You're going to eat your breakfast, take your medications, you'll get up, do your exercises, walk around a bit, and then you're going to elevate and ice with your toes above your nose for 20 to 30 minutes. That's pretty much what your day is going to consist of. Any questions about your swelling, whether it's appropriate, just call your surgeon's office. Pain management. Big, important question that everyone's concerned about. We're putting a total joint in your leg. You will have some pain, but we want to manage your pain, and we have a multimodal pain management approach that's really going to help, but you have to understand it. So when you're in the hospital, make sure you let the nurses know where your pain is. And if the pain medication they're using in the hospital is effective, if it's not effective, we can change it to something before you get home that is effective. If you're having any problems with nausea in the hospital with your pain medication, let the nurses know. But I want to reinforce that your pain is not going to be completely relieved. You're going to have some pain, but it's going to be pain you can deal with and that you can manage. So the key to successful pain management is number 1, ice and elevate. I can't say it enough. Number 2, balance your rest with activity. Get up and walk around once an hour for 5 to 10 minutes, and then Do some exercises, rest, ice, and elevate. Review your homegoing instructions before you're discharged from the facility, and make sure you take your medication as directed. So your pain medication, your narcotic pain medication, will be something given to you to use on an as-needed basis. As needed means when I have my pain, I'm going to take it. But now let's talk about this pain scale thing. The pain scale is something they may or may not use in the hospital or the surgery center, but it is something that we'll ask you about on the phone if you call in and say, gosh, my pain's not well controlled. 0 is no pain. 10 out of 10 pain is unmanageable or out of control. If you are unable to carry on a conversation, be distracted with television, you don't feel like you can walk or do your exercises because of pain, please give us a call. That's a good description in my mind of 10 out of 10 pain. We want your pain managed somewhere around a 3 to a 4. Mild to moderate pain, I can deal with it. But don't wait until your pain's out of control to treat it. Don't wait till you're to a 10. When it starts to escalate, that's the time to take your narcotic pain medication. Remember, pain medication is just one small piece of your pain management control. So keeping a record of your pain level is a good idea, because if you call the office and you say, gosh, I don't think my pain is managed, then you can go back through the days before and say, this is what my pain was doing. Perhaps you're too active. Perhaps you're not elevating enough. Perhaps you're not taking the pain medication at the best time. If you are only taking pain medication to sleep, it may allow you to get to sleep, but it may wake you up after you've been asleep for 3 to 4 hours. You see, narcotic pain medication steals your REM sleep, that deep sleep. So it's nice to allow you to get to sleep, but it may not allow you to sleep all night long. So as your pain starts to lessen, don't use narcotic pain medication for sleeping pills. If you're struggling to sleep, and let me tell you, all of our patients struggle in the first 30 days to sleep. Your leg's just not comfortable, it's heavy, you're trying to move around in bed and you just can't do it well. If over-the-counter sleeping medications don't help you, call your family doctor and see if you might just need to be put on a short-term sleep medication that's prescription. Remember, when your pain starts to back down, try and slow down on your narcotic pain medication. We don't want you to use that too long. So if your pain is most of the time a 3 or a 4 and you may not need to use that, consider using it only right before you go to therapy. Those therapists are supposed to work you hard and they may increase your pain a little bit. So taking it before therapy is a wonderful idea. Pain medication is written as needed, every 4 to 6 hours. That doesn't mean you need to take it around the clock, but if you're having pain around the clock and you need to take it, that's okay. If it's not relieving your pain, call your surgeon's office. You may also be directed to take over-the-counter pain medication, perhaps Advil, Tylenol, those sorts of things. Those can be used during the day, and then the pain medication that's narcotic can be used as needed. Questions about this, because I know this is a hot topic, just give us a call. We're there for you. You can call us in the middle of the night if you're struggling. Do not wake yourself up at night to take your pain medication. If you're sleeping, just keep sleeping. Protect your stomach when you take these medications. They may cause a little bit of nausea, so take them with food on your stomach. If your pain medication is really causing a lot of nausea, call your surgeon's office. We may need to switch you to a different type of medication. Side effects of narcotics are lots of them. They do relieve your pain, but they cause lightheadedness, they disrupt your sleep, they may cause you to be a little bit fuzzy and might increase your risk of falling. So move about slowly when you're taking narcotics. Don't try and zip up the steps, and don't go from sitting to standing or laying to sitting very quickly. They may cause you to lose your appetite. Mild nausea or appetite loss is fairly common. So that's why we don't want you on these medications too long of a time. They're appropriate in the early part of your recovery, but they're not appropriate for long-term use. The biggest effect of narcotics, and I've said it before, I'm going to say it again, it's constipation. We want you to prevent constipation before it happens. Continue to take your stool softener until you are off the narcotic pain medication and resume your normal bowel habits. You can use anything like Colace or Senecot, or ask your pharmacist for a good over-the-counter stool softener. I want you to increase your fluids. Maybe drink 7 or 8 glasses of water a day. Increase your fruit and your fiber before surgery. And then after surgery, if you're struggling with constipation and you've gone 24 to 48 hours without a bowel movement, try milk of magnesia as directed on the bottle. So go ahead and get milk of magnesia into your house. Now, if you go 48 to 72 hours, 2 to 3 days without a bowel movement, I'd like you to try something called magnesium citrate. You can buy that over the counter at the pharmacy too. If it's longer than that, please call your family physician for directions. Even if you say, well, I barely took the narcotics when I got home, you took a couple in the hospital, and even that small amount may cause you to be constipated. So, good bowel habits, fruit, fiber, water, stool softeners, I can't say that enough. If you don't have a bowel movement in several days, call us or call your family doctor. Refills on your narcotics. That's kind of a big deal right now. There's new laws in the state of Ohio that don't allow surgeons to prescribe narcotic medication for a long period of time. We are not allowed to put a refill on your narcotic prescription. So pay attention to how many you have left and how you're using them. If you're using them 3 times a day and you only have 10 pills left and it's Thursday, you need to give us a call because we can't give you narcotic medication on the weekend. Always allow 3 days to process a request for medication. So do you see how important it is to pay attention to how many pills you have left? Ohio law prohibits pharmacists from filling prescriptions for narcotics that are over 14 days old. And there's only a brief period of time that we are allowed to prescribe for you. If it's anything over 6 weeks, there are different laws that restrict our surgeons from prescribing additional narcotic pain medication. Any questions about this, give us a call. Be very knowledgeable about this before you come into the hospital or the surgery center. So let's talk about complications that may happen after your surgery. Total joint replacement surgery has a low risk of complications. You play a very important part in reducing your risks of complications. Here are some tips on how you can help reduce some of these risks. Pneumonia. Each of you will be giving a breathing tool and instructions on how to use it prior to going home. Continue to use this breathing tool, called a Volurex. It's in the picture here. Remember to cough and deep breathe multiple times throughout the day. Continue to use your tool, your Volurex, for as long as you're taking narcotics, because narcotics are going to diminish your breathing, deep breathing. So we want to prevent this pneumonia from even starting. If you have any concerns that you might have us, call our office. Let's talk about wound care after surgery. Make sure you follow your surgeon's instructions. Let the shower, soap, and water gently run over your incision. There's no need to wash or scrub your incision unless you were instructed to. After you shower, pat the incision dry with a freshly laundered towel, and then follow your surgeon's instructions for applying a dressing. And make sure you look at your incision every day. It's normal to have a little bit of drainage the first couple of days. I call that scant, a couple of dots on your dressing. Your dressing should not become saturated. If it does and it continues to ooze, you need to call your surgeon's office. We want to ensure that you help reduce your risk of blood clots by doing the following things. Wear your TED hose or compression stockings if your surgeon has prescribed them. You may remove your compression hose to wash every day or two, hand wash them and air dry them. Putting them in the dryer may cause them to shrink. Blood clots occur because you're much more sedentary than you normally are. You're just not up and moving around as much. So the signs of a blood clot are something that we teach you to look for. Swelling, calf swelling or leg swelling that doesn't improve with elevation. Calf pain or tenderness, or thigh pain and tenderness that is not getting better as your swelling improves. Make sure you're up and around and moving once an hour. Do your home exercises that you've been instructed. And make sure you're taking your blood thinner as it's prescribed. We do have a low risk of complications, but these are the things we look for. So if you have any questions about these, give us a call. So you want to get back to the life that brings you joy as fast as you can. Follow your post-operative instructions and we'll get you there. Bruising is normal. You're going to see some bruising on your leg, and it's probably going to increase in the first 3 days. I tell folks the third day home is usually your most difficult day for bruising, swelling, fatigue, and pain. Make sure you reduce your risk of falling. I must say that 3 or 4 times when my post-op patients come in. Don't fall. So use your walker as directed. Pick up your throw rugs, look at your house, be careful. If you're on an uneven surface and you think you don't need your walker anymore, maybe you do just for that surface. Or if you're in a big crowd and you don't want to get bumped. Falling is what you want to avoid at all costs. Follow up with your surgeon as directed. You may have a follow-up appointment in 2 or 4 weeks to see your surgeon. He's going to take an x-ray, check your wound, see what your function is. Rules for driving are simple. 1, you have to be off your narcotics. 2, you have to be off your walker. And 3, you have to be getting in and out of your car safely and easily. When you are finally allowed to drive, go slowly. Do a dry run in a parking lot, drive around your neighborhood. Make sure you have the ability to go from brake to gas, so if you have to stop quickly, you can. You may have a little bit of numbness around your wound, that's normal. So clicking or noise in your knee replacement after surgery may be normal. Also, your knee may be warm to touch in the early post-operative period. These are normal post-operative things for a knee replacement. Remember, this is an artificial joint, not the joint you were born with, and it will take 18 to 24 months to completely heal. Let's talk about hips for a minute. Hip replacement, in your recovery from hip replacement, you may have some specific poses that you need to avoid. It depends on your surgeon and the surgical approach as to what these poses will be. So follow your physical therapist instructions. They're going to help guide you through this. Use your reacher and your grabber and your sock aid to avoid bending over and getting things off of the floor. Make sure you're in a firm chair that's high enough with arms so that your hips are above your knees when you're trying to get out of a chair or change positions. Again, avoid recliners, no lazy boys. And sleep on your back. I know that's hard, and we can help you with using pillows and positional aids to get you comfortable. But it's not going to be comfortable nor advised to sleep on your side in the first 3 to 4 weeks. If you are having a knee replacement, your surgeon may recommend a CPM, a continuous passive motion machine, but again, that's surgeon dependent. Check with their office. Let's talk about post-operative physical therapy. Do you need it? Will you have it? Is it in your house? Is it outpatient? If your surgeon requires physical therapy after surgery, you will have arrangements made when you leave the surgery center or the hospital. If it's required in the home, they'll make those arrangements for you, and they'll tell you when they're going to call you and interview you and then start your physical therapy at home. It's typically only 4 to 6 visits. It's not a long period of time because we really want to get you to outpatient therapy as soon as we can. That's where the real work begins. Typically, your first outpatient physical therapy appointment, if your surgeon recommends it, is 2 weeks after your operation. So go ahead and set that appointment up now. Get that on the books. And then if you need to bump it back a little because you've had some problems, we can do that. But get that appointment scheduled before you go in for your surgery. Make sure you have made arrangements to get transportation to and from your physical therapy appointments. We want you to have your best outcome. We want you to return to normal activities of daily living as soon as you can. If you follow the directions that the therapist gives you, you'll get there, I promise. You can always refer to our Total Joint Education booklet, our binder, because exercises are in there too, and your physical therapist will actually use that book as a guide and show you the exact appropriate exercises for you. When should I call my surgeon? Well, here are some tips. If you get a fever of 101 or higher, call. It could be a number of things. It could be a urinary tract infection. It could be the start of a pneumonia. You may have a low-grade fever the first couple days you get home, 99, maybe even creeping up to 100. We don't worry too much about that unless it's persistent or you're feeling terrible or the fever goes higher. If you have increased drainage from your wound, call your surgeon. Remember, a couple of drops of drainage is completely normal and expected. But any more than that, we want to know that. If you're having pain that is absolutely uncontrolled by your medications, my pain level is a 9 or a 10 or an 8 all the time, no matter what I do, call us, because it could be some other factors that are contributing to your pain, and we need to know that. If you have swelling that never goes away after you elevate, pain that's uncontrollable, unmanageable, and you've done all the things we've told you, call us. Especially if you have swelling in your calf or calf tenderness that never improves. If you have shortness of breath, chest pain, if you are experiencing those symptoms, call 911. We don't advise you or your family member to drive you to the emergency room. But if you have any concerns about anything and you're not sure whether you should call us, the only mistake you can make is not to call us. Your engagement throughout the entire process of surgery and recovery is the key to success. Orthopedic One puts you first. Your care is individualized. We are so honored to take care of you. Thank you. If we have not addressed something in this Total Joint Education class, just call your surgeon's office. They have a team of people ready and waiting to help you, and they're happy to do that. So hopefully, all of your hard work that you're putting into this rehab, educating yourself, getting optimistic, bringing a beautiful attitude into the operating room, is going to get you back to the things that bring you joy. You're going to be hiking again. You're going to be riding your bike, playing with your grandkids, going to soccer games, gardening, doing the things that bring you joy in your life. That's why you're having joint replacement. Thanks for listening to me today. Have a great day.